Good morning, everyone. Dear friends. So let's start the session. The wonderful 15 pass gate point. हम 15 पास गेट पॉइंट्स के बारे में बात करने वाले हैं. Pass gate points are really very important because when there is a blockage of the energies, formation of lump, diabetic lump, diarrhea lump, reproductive problem lump, ovarian cyst lump. So there are multiple lump formation in the human body. These lumps are formed on the barrier points, on the pass gate points. तो हमारे शरीर में से 15 स्थान पाए जाते हैं जहां पर लंप का निर्माण हो जाता है. जैसे किसी को डाइजेशन की प्रॉब्लम हुई तो लंप बन गया एक, ओवरियन सिस्ट में एक अलग जगह लंप बन गया, डायबिटीज में अलग लंप बन गया. अलग अलग प्रॉब्लम में अलग अलग जगह लंप्स का निर्माण होता है. दैट इज कॉल्ड बैरियर पॉइंट, राइट? So barrier can be considered like a big road. You are moving in the big road. There are many people together are moving in the big road, and there are lots of traffic in that road, and suddenly that road become narrow. So there is a be stuck in the traffic. Lots of energy want to rush from the narrow area. So sometimes it gets stuck and form the lump there. We can massage the lump and we can dissolve it. तो जब कोई बड़ा रास्ता सकरा हो जाता है, वहां पर लंप का निर्माण हो जाता है, उसी को मसाज करके हम निकाल सकते हैं. We can put the needle, we can do the massage, we can do the acupressure on this lump to create the desired effect. So because of the narrow path, that area gets stuck, and that is called pass gate point or barrier point. For example, if we talk about look at in this image for more and clear understanding. So we can see here, this is the road and one car is moving in this road. And suddenly maybe another car also moving on the same road. And here is a very narrow path. Maybe 2-3 cars are moving together. And there is a very narrow path, they get stuck here. So there is a formation of the lump here. Nodule. Or maybe only painful area. ऐसा अक्सर होता है जब आप किसी व्यक्ति को एक्यूपंक्चर ट्रीटमेंट देते हो. सपोज यू आर गिविंग द ट्रीटमेंट टू समवन and you are releasing the energies from this part because the person is having blocked energy here. Now energy start flowing and when energy start flowing, maybe from this path and get stuck at somewhere. Patient will tell you, doctor, I was not having pain here. I was not having pain at the location of CB4, but after your treatment, I am having pain. Why? You have created my new pain. Even I am bothering for my previous pain. I am having pain in my scapular region, but via treatment, I start getting pain in my lower abdomen. कि डॉक्टर साहब कि पहले तो मुझे दर्द नहीं था यहाँ पर, अभी चालू हो गया. पहले तो मुझे सिर्फ पीठ का दर्द था, आपके ट्रीटमेंट के बाद नीचे पेट के लोअर पार्ट में दर्द चालू हो गया. Why? Because you are releasing the chi and the chi is want to move for the better for the betterment of the persons. So it got stuck. So that is called the pass gate point. So what is the solution? कि हमें सॉल्यूशन यही करना होगा कि हमें उस ऊर्जा के रास्ते को वापस फ्लो में लाना होगा. We have to remove the blockage, and in such case we have to identify the blocked area and release the energies. This is the treatment, right? So this is the list of the 15 pass gate point here. Very, very important. Energy might get stuck at these areas. We will be discussing all the points one by one. So the 15 pass gates, right? Let's start with the discussion of CB4. हम पहले CB4 की बात करते हैं. CB4 is called the main door out of all the doors. जितने भी दरवाजे हैं उन सभी दरवाजों में सबसे प्रमुख दरवाजा है CB4. This is the main door out of multiple doors. So this is called the head of the pass gate. There are multiple gates. There is a garden. In that garden, we are having multiple gates. But one is the main gate. This is the main gate. Even one gate here, but that is not the main gate. One gate here, not main gate. So this is a gate number 1. This is a gate number 2, gate number 3, maybe gate number 4 is here, but this is the main gate, which is called CB4. So CB4 is the head of all gates. Okay, now. So it is called main door, or we can tell main gates out of all the gates, right? Okay. In the TCM, it has been explained that CB4 is a very important point. Why? Because two purpose. Because of two purpose. In the TCM, it has been explained, it is good point for two purpose. Number one purpose. CB4 is the alarm point of small intestine. कि हमारी स्मॉल इंटेस्टाइन का अलार्म पॉइंट है. It means if there is any problem in the small intestine, you will be feeling the pain here. The second, it has been considered crossing point. Crossing point where all the 3 yin meridian of the leg are crossing and meeting with the ren meridian. हमारे पैर में 3 मेरिडियन होते हैं. स्प्लीन मेरिडियन होता है, किडनी मेरिडियन होता है और लिवर मेरिडियन होता है. तीनों की मेरिडियन इस पॉइंट को क्रॉस करते हैं. ये मीटिंग पॉइंट कहलाता है ऑफ ऑल द मेरिडियन, राइट? CB4. तो ये दो इंपॉर्टेंस है. पहला ये अलार्म पॉइंट है और दूसरा एक क्रॉसिंग पॉइंट है. अब आप समझिए, इतना सा पॉइंट, जरा सा, और इतना ट्रैफिक कि स्प्लीन को भी गुजरना है, किडनी को भी गुजरना है, लिवर को भी गुजरना है, और रेन तो है ही. रेन itself is a very having good energies, and all the 3 meridian want to cross this area. So this area sometimes get stuck, and there is a formation of the lump on the area of CB4, right? So see, if we stimulate the generally, CB4 is a very important point. I told you it is a front viewpoint of small intestine. What is the meaning of small intestine? आपको क्या लगता है small intestine का मतलब क्या है? Write on the chat box. What do you think about the meaning of small intestine? It's just a part where food is reaching. आखिर स्मॉल इंटेस्टाइन का मतलब क्या है? क्या ये वो पार्ट है कि खाना खाया फिर स्टमक में गया फिर स्मॉल इंटेस्टाइन में गया? आई एम टॉकिंग अबाउट दैट? नो, not only that part. Okay, that also there, but the meaning of small intestine, that is called, this is the acupuncture language, very secret language. Small intestine is the husband of heart. Am I right or not? अगर हार्ट यिन है तो स्मॉल इंटेस्टाइन yang है. Yes, all the yang channel having responsibility to help the yin, all the male channel having responsibility to help the female, all the husband having responsibility to help the wife, right or not? So small intestine has been considered as a blood vessels because heart will pump the blood and small intestine will distribute around. तो स्मॉल इंटेस्टाइन को ऊर्जा के कंसेप्ट के आधार पर हमें ब्लड वेसल मानना ही होगा और मानते भी हैं. If there is any problem inside the blood vessels, maybe there is a poor flexibility of the blood vessels or blood vessel get narrow, so person is suffering with a high BP or any blockage inside the blood vessels, there is a deposition of the cholesterol, there is a formation of the plaque inside the blood vessels, we have to think, oh, blood vessel means the husband of heart. Heart is pumping the blood vessel is distributing all around. So we have to work on the small intestine. CB4 is the very good point. That's why it has been considered, if you stimulate the CB4 regularly, there is a very lesser chances that you will be suffering with the problem of heart and the blockage in the capillaries. तो ये इसकी संभावना काफी कम हो जाएंगी कि आपको कहीं ब्लॉकेज ना हो जाए. अरे हो रहा है तो आप इसे रोक सकते हैं. Second consideration I would like to tell you, the CV4 is the alarm point of SI that we know. Another so another condition I want to explain here. Under the discussion of meridian, we have discussed that there is a river. This is the river. So before that point, we are telling it Ganga River. And after this point, we are telling it Yamuna River. River is the same. तो एक नदी है, इस स्पॉट के पहले उसे हमने गंगा नदी नाम दिया और इस स्पॉट के बाद हमने उसे यमुना नदी नाम दिया. In the same way, we talk about the human body. If we talk about the human body, right? So there is a meridian called, there is a meridian, a small intestine. In the upper part, it is called small intestine. And in the lower part, the same meridian is called urinary bladder. So small intestine and urinary bladder both together are called तायान. तो एक नदी है, उस नदी को के आधे भाग को हमने बोला एसआई और आधे भाग को बोला यूवी. Both are connected, both are the same river. Now definitely the SI having some different characteristic, UV is having some different characteristic, but they are connected with each other, they are affecting each other, they are influencing each other. They also called long meridian. इन्हें long meridian भी कहा जाता है. ये दोनों connected हैं, ये दोनों एक दूसरे को प्रभावित करने वाले हैं. So if the person is, if you are stimulating the CB4, CB4 is the alarm point of SI. It also very good point for urinary problems. Urinary. It's a very good for prostate enlargement. It's a very good point for male and female genital problems. CB4. स्पेशली मैं कहना चाहूंगा कि यूरिनरी ब्लैडर, यूरिनरी प्रॉब्लम्स, प्रोस्टेट को कंट्रोल करता है, तो CB4, दैट्स व्हाई CB4 हैज बीन कंसीडर्ड एज ए वेरी गुड पॉइंट फॉर ओल्ड एज। कहते हैं कि बुढ़ापे में आप सिर्फ एक पॉइंट को नियमित रूप से स्टिमुलेट करिए, CB4, इट विल टेक केयर योर हार्ट, it will take care your urinary bladder, it will take care your prostate or the male female genital part. So CB4 is called single point for old age, single point for CB4 from the navel. If we are going 3 chun down, अगर नाभि से हम 3 चुन नीचे जाते हैं तो हमें CB4 मिलता है, and if there is any disharmony we will see the lump here, right? So in this way CB4 is the point who will improve the kidney chi, who will improve the kidney yin, who will improve the kidney yang, who will improve the kidney yin. Wonderful. कोई कोई पॉइंट्स सिर्फ येन बढ़ाता है, जैसे कि किडनी 6, किसी किसी पॉइंट्स के पास ये ताकत होती है कि वो सिर्फ यांग बढ़ाता है. सम पॉइंट्स आर जस्ट इंक्रीजिंग द यांग, we can see SI3, but there are few points they are improving yin yang, even the overall chi, even the essence, that is CB4. तो CB4 के बारे में कहा जाता है कि it increase yin, it improve yin, it improve yang, it improve chi, it improve essence, it improve jing, it improve everything. CB4 बहुत अच्छा, गजब का. So this is the wonderful point. We can massage this point. We can definitely, we can even stimulate the sujo. But if you are getting the lump on the original location, you will be also getting very painful, little painful effect on the sujo. Any points, the pass gate point, we are generally stimulating on the original location because we can also do massage, but we can also stimulate in the sujo. Now there is a condition that is called scoliosis of the spine. स्पाइन जब टेढ़ी हो जाती है, इस घटना को हम स्पोलियोसिस कहते हैं, इस प्रॉब्लम को स्कोलियोसिस कहते हैं. Because why the scoliosis is there? The reason of scoliosis may be at the certain area energy is high, and the certain area energy is low. So there is a game is happening between two parts of the body. So this is powerful. So pulling the spine on this side. हमारे शरीर में ऊर्जा का इरेगुलर डिस्ट्रीब्यूशन हो गया, कहीं ऊर्जा अटक गई तो स्कोलियोसिस हो गया, एक तरफ स्पाइन खिंच गई, कर्व हो गई. Why the CB4 is good point? Because CB4 is the union point of all the three leg meridian. If energy is stuck anywhere, we can just release by the CB4. ऊर्जा कहीं भी अटकी होगी, हम सिर्फ CB4 से रिलीज कर सकते हैं, right? Because if we see here, as per the concept of meridian, अगर हम मेरिडियन के कंसेप्ट के आधार पर विचार करें, we know the urinary bladder passing from here, right? The gallbladder meridian passing from the side. So if we are working on the liver, it will treat the gallbladder. If we are working on the kidney, it will treat the urinary bladder. We will able to remove all the blockages. So CB4 is the very good point which has been considered as a point for स्कोलियोसिस. हमने देखा है कि कई लोगों को यहाँ पर लंप का निर्माण हो जाता है स्कोलियोसिस में, या किसी किसी को लंप नहीं होता, उसे कठोरता वहां पर आ जाती है, उस पर द एरिया बिकम वेरी स्टिफ, दैट एरिया. यू हैव टू मसाज दिस पॉइंट. release the energy, let's flow the energy properly up and down. Then you will see slowly and slowly, maybe many months, maybe 8 months or 1 year, you will see spine is slowly and slowly coming in the normal and aligned position. So especially I would like to bring your attention once again. If we are stimulating the CB4, it starts sending energy downward. So it's a very good for the male and female genital part. And if there is a male and female genital part is having some problem, person also get the back pain. So we can work, we can stimulate, we can send the good amount of chi just by stimulating the CB4. CB4 को जब हम stimulate करते हैं, it's a very good point for the enlargement of the prostate in the male and impotency. बुढ़ापे में जो प्रोस्टेट की बीमारी होती है और इम्पोटेंसी की बीमारी इम्पोटेंसी होती है, उन दोनों में CB4 बहुत ही बेहतरीन काम करता है. So ultimately, look at here. It's a very good for impotency. The sperm is coming out automatically, and the enuresis, frequent maturation, यानी यूरिन की कोई भी प्रॉब्लम, या तो बार बार होना, अटक जाना, ज्यादा होना, irregular menstruation, menstruation की कोई भी प्रॉब्लम, ज्यादा होना या ना होना या दर्द के साथ होना, whether it's a dysmenorrhea means painful menstruation, or the metrorrhagia means too heavy menstruation, or leukorrhea, uterine problem, uterus problem, infertility, diarrhea, rectal problem, any problem in this lower part, we can treat with the help of CB4. So this was the first pass gate point. I think it's clear now. Is it clear? For the diabetic patient, we will be discussing another point. Okay. This is especially, this is a very good point for bringing the alignment and sending the chi in the lower area. But now let's move to the point number 2, that is called governing vessel 3. अब हम अगले पॉइंट की बात कर रहे हैं, इसका नाम है governing vessel 3. So governing vessel 3. Again, I would like to explain this point because this is a really very wonderful point. Even we have discussed in the first class, last class, previous class. So this is the location of governing vessel 3. Governing vessel 3 below the lumbar 4 vertebra. हमारे lumbar 4 vertebra के ठीक नीचे वाला बिंदु governing vessel 3 है. So governing vessel 3 is very important point. I can tell governing vessel 3 is the point. It is called, it is doing the compensation of the deficient energy in the lower abdomen. What is the meaning of that? If there is a deficiency of the energy in the lower abdomen because of any reason, we can stimulate this point and will send the energies. हमारे लोअर एब्डोमेन में किसी भी कारणवश अगर ऊर्जा की कमी हो गई है, तो हम गवर्निंग वेसल 3 के माध्यम से उस ऊर्जा को भर सकते हैं वापस, और वो कारण कोई भी हो, राइट? कंपेंसेशन, you will, the abdomen will get the compensation. Abdomen को compensation मिलेगा, right? So this is called yang passage of, this is called pass gate point of the loin area. हमारे इस loin area का यह pass gate point. So in this way, it's a really very wonderful. Now, in the previous class, we have discussed this. I will show you one image first. Look at here. Okay. In the previous class, I have told you that first you palpate the hip bone. सबसे पहले अपनी hip bone को palpate करिए ऐसे. First, you have to palpate the hip bone. Okay, hip bone is coming here. This is the hip, right? Hip bone is from the back side, we will palpate the hip bone, I told you. So suppose the hip bone coming to the hip, okay, both the side. Now from here, if I draw the horizontal line in the front side like this, but if I draw the horizontal line in the back side, अब यहाँ पर मैंने एक horizontal line back side में draw की, that is the lumbar 4 vertebra, lumbar 4 vertebra. तो lumbar 4 vertebra को पहले ढूंढिए कैसे, इसका हिप बोन का अपर बॉर्डर देखिएगा, ये हमारी हिप बोन है, राइट। और फिर इससे एक लाइन ड्रॉ करके पीछे चले जाए, जो बीच में पहुंचते हैं वो क्या है, लंबर 4 है। लंबर 4 पर पहुंच गए, उसके नीचे क्या है, गवर्निंग वेसल 3। गॉट इट, क्लियर। कैसे मिलेगा, तो पेशेंट को लिटाकर चेक कर लेंगे लंबर 4, ओके। Let's see one video because point is very much important. You can see one video how to palpate the point, how to search the point, governing vessel 3. You will get the idea that how we are searching the upper border of hip bone. Let's see here. So now you can see here, we are in the search of DU3 or governing vessel 3. So you can see I am palpating the upper border of the hip bone, drawing one line. This is the center point, that is called lumbar 4 vertebra. Below that, that is DU3 or the governing vessel 3. So we are putting the needle here, and there is no problem. But anyway, we have to search the point very properly. Here we can see in this image. इस image में भी हम देख सकते हैं कि हमने क्या देखा. At the upper border of the hip bone, when we are coming, then this is we are touching the lumbar 4 vertebra. Below the lumbar 4 vertebra in the center, we are having governing vessel, sorry. So this is the governing vessel, DU3, right? We can see here. So this is the DU3 just below the lumbar 4 vertebra, and the lumbar 4 vertebra at this level. So will you able to search it now? Able to search it? Because it is a pass gate point. We can even do the massage here, or you can put the cup for 3 minutes and remove it. So cup also doing the negative suction and releasing the energies. Okay, now तो इस तरह से हमने पाया, हमने समझा about the DU3. Let's discuss few more points about this. Okay. So we have seen this is the point below the lumbar 4 vertebra, right? So we now know that how to search the lumbar 4 vertebra, and below that we have this point. This point is called low back yang passage point. yang passage point. हमारी कमर का यानी लोअर बैक का यांग का पैसेज, इसका नाम, राइट? पास गेट पॉइंट, पैसेज पॉइंट, बैरियर पॉइंट. Why we are telling it barrier point? Definitely maybe narrow path here also. We already have discussed the barrier point, meaning of barrier point. We can consider, we can understand by this road. This road suddenly get narrow at certain points, energy might get stuck. So same thing happening with the governing vessel 3. All the barrier points are, or the pass gate points are very important. That's why we are discussing them. यहाँ पर फिर से एक गांठ का निर्माण हो गया, क्योंकि पात बहुत ही सकरा है। तो इसे कहते हैं कि भाई ये कमर का यांग पैसेज पॉइंट है, यहां से ऊर्जा को रिलीज करो तभी हमें फायदा मिलेगा, नहीं तो यहाँ पर ऊर्जा अटक जाएगी, पैरों में पहुंचेगी नहीं, तो पैरों में पैरालिसिस का इफेक्ट है। हो सकता है यहाँ पर उपाय करने से लाभ मिल जाए। So let's see here, the person is suffering with the numbness or the paralysis of the leg, okay, not able to bend the knee, then massage this point for good benefit. आप इस governing vessel 3 point की मसाज करिए और you put the needle, stimulate this point by any method, and whether you stimulate this point in the body or in the sujog, both are working. You can do as per your own learning. आपने जो सीखा है आप उसके अनुसार कर सकते हैं, because governing vessel 3 we have to stimulate, whether we stimulate in the body or sujog. But remember one thing, if the person is having numbness in the leg, weakness in the leg, weakness in the lower extremities, then do not forget to stimulate this point. It's a wonderful point. हो सकता है कि आप है ना, किसी ने कहा कि भाई मुझे पैरों में कमजोरी है, अब आप क्या कर रहे हो कि पैरों में निडल लगा रहे हो, है ना, घुटने के दर्द है, द पर्सन इज सफरिंग विद द नी पेन, यू आर ट्रीटिंग द नी, you are treating the calf muscle, but its energy is stuck there. I will tell you, I was treating one lady for the problem. She was having lower back pain and thus even sciatica pain. I have given some sitting. The response was very, very slow. Then suddenly one day I thought, okay, let's work on this point. I did blood relating on governing vessel 3 area. Okay. And remember one thing, blood letting is not mandatory. For many other patients, I never did blood letting. I just did the cupping, dry cupping. I put there. Some other patient I did only massage. But I will tell you, for the lady I did blood cupping, immediately energy opened and she start feeling good, better and better in every sitting. कि आपने एक बार ऊर्जा को रिलीज कर दिया। ऊर्जा को रिलीज कैसे किया, या तो ब्लड निकाल दो या फिर मसाज कर दो, कपिंग कर दो, किसी भी तरह से वहां से ऊर्जा को रिलीज कर दो, ऊर्जा के रास्ते को साफ कर दो, तो आप देखेंगे ऊर्जा का प्रवाह चालू हो गया, पैरों में होने वाले दर्द और नमनेस में फायदा मिलना चालू हो। सो इन दिस वे यू कैन क्रिएट द वेरी गुड इफेक्ट इन द legs while stimulating this point. So there's a single point governing vessel 3, but it's a very effective point for numbness and the paralysis of the leg. Person is not able to bend the knee, massage this point for good benefit, right? Now, if the person is suffering with the lumbosacral pain, कमर में दर्द हो रहा है, and spermaturia, there is excessive or involuntary seminal discharge. स्पर्मेटोरिया जब मेल के अंदर उनका जो मेल जेनिटल सिक्रेशन होता है वो अपने आप निकल जाता है, तो उसे कहते हैं स्पर्मेटोरिया। जैसे फीमेल में ल्यूकोरिया, मेल में स्पर्मेटोरिया। So in the condition the person is not able to hold the semen, person is having some problem in the lumbosacral area, and person is not able to hold the semen, suffering with the impotency and irregular menstruation. In these all condition we can stimulate this point. इन सभी प्रॉब्लम्स में हम इस पॉइंट को स्टिमुलेट कर सकते हैं, and we can send the good amount of energies all around. We can send the good amount of energies in the lower back. We can send the good amount of energy in the abdomen. We can send the good amount of energy in the leg and knee. हम इस पॉइंट को स्टिमुलेट करके लोअर बैक में, एब्डोमेन में और लेग में अच्छी ऊर्जा भेज सकते हैं. Even we can send the good amount of energy in the genital part, like in the uterus, and for male in the male genital part, right? तो गवर्निंग वेसल 3 एक बहुत ही स्पेशल पॉइंट है. Now let's move to the point number 3, that is kidney 12. There are 2 points found in the kidney meridian, kidney 12 and kidney 18. हम 2 पॉइंट की बात करेंगे. तो चलिए पहले हम बात करते हैं किडनी 12 से. Kidney 12 and kidney 18. There are 2 points. They're very good. Now look at here. From the pubic bone, ये हमारी pubic bone है और ये नाभि है. This is the navel. The distance is 5 chun. From the navel to the pubic bone 5 chun की दूरी होती है. आप इसे उंगलियों से नाप सकते हैं. How to measure by the finger? You can measure by the 7 finger, because this is the 3 chun. We know 4 finger is equal to 3 chun. 3 finger is equal to 2 chun. So 3 and 5. 3 and 5. Total become 5 chun. From the navel, if we are going 5 chun down, we will feel one bone. That is called pubic bone. Right? So on the pubic bone, we are having CB2 point, and on the navel, we have CB8. नाभि पर जो बिंदु पाया जाता है इसे हम CB8 कहते हैं, और जो pubic bone पर जो पॉइंट होता है उसे CB2 कहते हैं. अभी हमारी बात है. So now let's see this image for clear understanding. So on the pubic bone, this is the location of CB2. If we go 1 chun up, that is the location of CB3, right? Then again 1 chun up, CB4 in this way. So from the pubic bone, we are going 1 chun up. At that level, we can see kidney 12 point. Now remember one thing, kidney 12 or kidney 18, we are going to discuss 2 points. Both are barrier point. Barrier point. दोनों की दोनों barrier point है. चाहे kidney 12 की बात करें या kidney 18 की बात करें, दोनों के दोनों barrier point है और दोनों kidney meridian, right? So now, as per the, if we see, these are the point. If we talk about the point number 1, kidney 12, अगर हम kidney 12 की बात करें, from the navel we can see ये कितना नीचे, 4 चुन नीचे. Okay, we are understanding now. Now both the points, kidney 12 and the kidney 18, very good point for kidney and urinary bladder. Good. एक बात ध्यान रखिएगा कि जब भी हमारे किडनी में कोई डिसहार्मनी होती है, I would like to tell you one thing here. As per the concept of pass gate barrier, कि कहते हैं कि जब भी किडनी में डिसहार्मनी होती है, you can see the pain in the eyes here. That is called canthus. Canthus means corner. This is the inner canthus, this is the outer canthus. So this is the inner canthus who is near to nose. That is canthus nasalis. तो जब भी किडनी में डिसहार्मनी होती है, यहां पर रेडनेस और दर्द मिल सकता है. Very wonderful thing. So if the number, so there are 2 things we have to understand here. Point number 1, if disharmony in the kidney, we can diagnose, oh, there is a redness and pain here inside the eyes, in the canthus near the nasal bone. कि किडनी में कोई डिसहार्मनी है तो आंखों के कॉर्नर में दर्द है, आंखों की कैंथस में दर्द है, वो भी नाक के पास, इसलिए कहते हैं नेजलिस कैंथस, कैंथस नेजलिस. Other thing, even if the person is having pain here, we can release with the kidney 12. Actually, kidney 12 is a very good point. It has been considered, it is the point where two meridian are crossing at the kidney 12, even on the kidney 18. आपको आपने सुना है एक्स्ट्रा ऑर्डिनरी वेसल, सुनी है ना सभी? एवरीवन नोज एक्स्ट्रा ऑर्डिनरी वेसल्स. एक्स्ट्रा ऑर्डिनरी वेसल्स इज लाइक ए, ये कहते हैं ना कि पंडित जी आज आपके घर में जजमान बने और आपके घर में रुके हैं. कल एक दिन गए वो मुंबई प्रीति जी के यहाँ, दूसरे दिन गए वो कलकत्ता सुकृति जी के, तीसरे दिन चले गए वो मैसूर मीना जी के यहाँ. तो पंडित जी से पूछा आपका घर कहाँ है? अरे यही तो मेरे घर है. प्रीति जी का घर मेरा ही है, सुकृति जी का घर मेरा ही है, मीरा जी का घर मेरा है. Okay, so extraordinary vessels is not having own house. They are just going, jumping from the point to point, and they can jump. They are free. They are not having any foundation. Like liver is having foundation. That liver point has to move from liver 1 to liver 2, then the liver 3, then the liver 4, then the liver 5 till the liver 14. तो लिवर मेरिडियन के जितने भी पॉइंट है वो लिवर में ही मिलेंगे. But if we talk about the extraordinary vessel, suppose I am telling yang linking vessel, yin linking vessel, there are 8 extraordinary vessels. They are, out of 8, there are 6 vessels, they don't have their own house. वो बस ऐसे घूमती रहती है. उसमें एक होती है चोंगमो, चोंगमो वेसल. चोंगमो वेसल से पूछा भैया तुमको कहाँ कहाँ जाना है? चोंगमो वेसल. So Chongmo vessel is telling, okay, first I will go to the genital part, Chongmo. Then, so Chongmo vessel is moving right. Okay, first I will go to the genital part. Then I will coming to the digestive part. I will eat something. Then I will go to the heart. I will see heart is working properly or not. Then I will go and coming to the tongue. So Chongmo vessel is moving here. Chongmo means spleen 4. The master point of Chongmo is spleen 4. तो चोंगमो अगर किसी ने कहा कि भाई अरे फीमेल को जेनेटल पार्ट में प्रॉब्लम हो गई है, oh Chongmo spleen 4, because Chongmo means all the extraordinary vessels are very special. Even though if you stimulate them, you can create the very great effect. Spleen 4 very good for genital problems. Spleen 4 whether poor menstruation or excessive menstruation, male genital problem, female genital problem, it's working in all the genital problems. It's working for the gastric problem, diarrhea, very good. Constipation, very good. Gas acidity, very good. Abdominal pain, very good. CV, spleen 4 is the very good point for gastric problem. तो स्प्लीन 4 की बात करें तो जेनेटल प्रॉब्लम के लिए भी अच्छा है और गैस्ट्रिक प्रॉब्लम के लिए भी अच्छा है. It's a very good point for the heart. If someone is having heart pain, we can stimulate spleen 4. Heart problem, heart disease, spleen 4. Then tongue, any problem with which is connected with the test. So kidney 12 and the kidney 18 are the point where Chongmo is crossing. Chongmo. क्योंकि चोंगमो को तो दूसरे घरों से निकलना है, तो किडनी के ये 2 पॉइंट है और भी कुछ पॉइंट्स है, लेकिन यहां से चोंगमो निकलती है, राइट. समटाइम देयर आर टू मेनी पर्सन वांट टू पास फ्रॉम द किडनी 12, लाइक किडनी मेरिडियन वांट टू पास, चोंगमो वांट टू पास, इवन मे बी सम अदर पर्सन एनर्जी आल्सो वांट टू पास, सो दे गेट स्टक हियर. तो किडनी 12 पर और किडनी 18 पर लंप का निर्माण हो जाता है, यहां पर ऊर्जा अटक जाती है. आप समझो कि वो चोंगमो भी निकलना चाहती है वहीं से, किडनी को खुद तो निकल नहीं है और फंस गए दोनों, फंसा फंसी है ना, तो ऊर्जा अटक गई यहां पर. सो इन दिस वे ब्रह्मास्त्र, in this way the kidney 12 and the kidney 18 is very good point, because both points, whether the kidney 12 and the kidney 18, they are the crossing point of kidney and Chongmo. Chongmo is the extraordinary vessel. हमारे शरीर में कुल 8 ही extraordinary vessels होती हैं बस. And this is the kidney 12, and even we see kidney 18 also. So when we are massaging the kidney 12 or when we are massaging the kidney 18, we are improving the Chongmo, we are improving the kidney, we are improving both. हम दोनों को improve कर रहे हैं. So number one, I would like to tell you, the kidney 12 is the passgate point of yin. Okay, passgate point of yin. Number two, we can see here, this is the kidney meridian is passing. The Chongmo meridian also going from there, right? So the kidney 12 is called the Leo connecting point. Why the Leo connecting point? Because it's connect with the kidney and the Chongmo. Leo का मतलब होता है, Leo का मतलब क्या होता है? What is the meaning of Leo connecting point? The meaning of Leo connecting point means bypass, right? So this is the kidney meridian is going from here, but there is a bypass here. So from there, Chongmo also coming, Chongmo. So this is the point, the combination of Chongmo and the kidney. That's why kidney 12 is called Leo connecting. Okay. So here, very important, the kidney 12 is called door of yin. इसे कहते हैं yin का दरवाजा. It removes all the blockage in the root of the kidney meridian. And I already told you, if there is a painful eyes that involve the canthus nasalis part of the eyes, अगर आपको दिख गया कि भाई इसकी आंखों के अंदरूनी भाग में कोई तकलीफ है, सबसे पहले किडनी 12 और किडनी 18 को ट्रीट करो. सबसे पहले first you treat the problem is here. First you remove the blockages from kidney 12 and the kidney 18 because the energy is stuck there and not able to reach here. So in this way, we have to think and we have to work accordingly. So now, because it's the door of kidney, it's the door of kidney का the door है. हम जानते हैं kidney का काम क्या है? The work of kidney. If the genital part is not aligned, very important. कि इसको सामान्य भाषा में समझा सकता है कि मेल का जो जेनिटल पार्ट है वो टेढ़ा है, कर्व्ड है. The male genital part is not the L-line, it's curved, deviated on one side, right? Why? Because the energy is not reaching properly, kidney meridian is stuck, Chongmo is stuck, both supplying the genital part. तो मेल का जेनिटल पार्ट टेढ़ा हो जाता है, कर्व्ड हो जाता है. हम किडनी 12 का प्रयोग करके वहां की ऊर्जा की ब्लॉकेज को रिमूव कर सकते हैं. तो किडनी 12 is a very good point for that. And we know the kidney is also having connection with the too much tiredness, any lump formation here. Massage regularly on this point for balancing. यहाँ पर लम्प का निर्माण मिले तो इस पॉइंट को मसाज करिए और imbalance को निकालिए. This is a very good point and strengthen the kidney and urinary bladder. हमारी किडनी और यूरिनरी ब्लैडर को स्ट्रेंथन करने वाला एक बहुत ही स्पेशल पॉइंट है किडनी 12. So the kidney 12 point is a very good point again for spermatoria, impotency, uterine problem like the prolapse of uterus and leukorrhea. कि ये करता क्या है? कहते हैं कि किडनी 12 पॉइंट ईसेंस को बांध कर रखता है. बांध के रखने का मतलब क्या है? पकड़ के रखता है. Like it will hold your essence, kidney 12. So female are having leukorrhea, essence is destroying, male are having spermatoria, the daily damaging the kidney is daily essence is getting damaged. So kidney 12 point is holding the essence. Okay, ये हमारे essence को hold करके रखने वाला point है. Let's move to the next point, kidney 18. Kidney 18 एक बहुत ही शानदार point है. Kidney 18, the another point in the kidney meridian, we can see. First, I would like to tell you, it is called stone gate. Definitely we can if someone is suffering with the kidney stone, definitely we can work with the help of this point. But other meaning, this point is called kidney 18 means we are cutting the stone and we are making the path. कि पत्थर को काट कर जो दरवाजा बनाते हैं वैसा बिंदु है किडनी 18. यानी किडनी 18 एक टनल की तरह है और किडनी 18 एक गुफा की तरह है. Now again you have to understand, in the tunnel there is a limit. Like in the tunnel, maybe one or two train might pass, one or two taxi or bus or car might pass, right? They have to go in the queue because tunnel is having narrow space. तो पत्थर में जो काट के रास्ता बनाते हैं वो है किडनी 18. यहाँ पर ऊर्जा कभी कभी अटक जाती है और यहाँ पर जैसी ऊर्जा अटकती है तो किडनी 18 पर लंप का निर्माण हो जाता है. इसलिए किडनी 18 को कहते हैं पत्थर को काटकर बनाया गया दरवाजा और पत्थर और काट पीट कर मे बी मिट्टी को खोदकर काटकर बनाई गई गुफा. Means something like this. You have to enter in a small cave. That is the kidney 18, right? So in the one word we are telling it stone gate. Stone gate. Stone gate also explaining many things about this point. We can see stone gate, right? Now, so you look at in this image at the from the navel, at the level of navel we are having kidney 16. नाभि के लेवल पर हमारा किडनी 16 नाम का पॉइंट होता है, right? Generally all the point of the kidney meridian are having one chun gap, one chun, right? But here from the kidney 16, हम किडनी 16 से दो चुन ऊपर जाते हैं तो किडनी 17 मिलता है और फिर वन चुन ऊपर जाते हैं तो किडनी 18 मिलता है. उसके बाद सारे पॉइंट एक एक चुन पर है. ऑल द पॉइंट ऑफ द किडनी मेरिडियन आर जनरली वन चुन अप. Or we can directly understand from the navel, if we go 3 chun up, we will find the kidney 18, and kidney 18 or the kidney, any point of the kidney meridian are half chun, bilateral. हमारे नाभि से हमारे सेंट्रल लाइन से आधा चुन इधर और आधा चुन इधर आप जब एक लाइन बनाते हो तो आपको किडनी का मेरिडियन मिलता है. किडनी 18 is 3 chun up, right? Okay, so this is the pass gate point, pass gate of the stone, and it improved the deficient energy of the spleen and the kidney organ. ये हमारे स्प्लीन और किडनी ऑर्गन की डेफिशिएंट एनर्जीज को बैलेंस कर. And again I will tell you once again, I already told you kidney 18 is the point where two meridian are crossing. Number 1 kidney, number 2 chongmo. So it is a crossing point of kidney meridian and the chongmo vessel. Okay, kidney 18. तो जब भी हम किडनी 18 को ट्रीट करते हैं, whenever we are trying to treat the kidney 18, we know it's near the stomach area. Stomach is here, right? And we already have discussed that the chongmo is going in the genital part, then chongmo is going in the digestive part. So the lower point kidney 12 is more connected with the genital part, and the upper point kidney 18 is more connected with the gastric part. यानी ये समझिए कि हमारा किडनी का मेरिडियन अब हमारे पाचन तंत्र से कनेक्ट हो गया। ओके, यहाँ पर so if the person is having vomiting, pain in the abdomen, constipation, we can treat with the help of this part. Kidney 18 is the very good point. Person is having gastric problem, so foul smell, belching is coming out. एक व्यक्ति को पेट की बीमारी है तो मुंह से भी बदबू आती है और उसके डकार में भी बदबू आती है, राइट। एंड आई ऑलरेडी टोल्ड यू, रेड आईज, आंखों का लाल हो जाना, स्पेशली इनर कैंथस का। द फॉल स्मेल ऑफ बॉडी सीक्रेशन, any secretion, maybe urine is having foul smell, sweat is having foul smell, any foul smell coming from any body secretion. Kidney 12 is very good point. Even it's a very good point for urinary bladder and the kidney. So for the stuck urine, we are treating this point. But special indication is stomach. मुख्य रूप से यह ऊपर होने के कारण अब इसका जो कार्य क्षेत्र है वो स्टमक है। सो डन फॉर टुडे, आज के लिए इतना काफी। अब हम आगे का डिस्कशन कल की क्लास में करेंगे। रिकॉर्डिंग्स जिन लोगों ने लिंक से एनरोल किया है ना, उनको वहीं मिल जाएगी अभी कुछ समय के बाद, राइट, वहीं पर मैं अपलोड कर दूंगा। सो थैंक यू सो मच। इफ यू हैव एनी क्वेरी प्लीज पुट इन द ग्रुप। थैंक यू सो मच। क्लोजिंग द सेशन। गुड मॉर्निंग एवरीवन एंड हैव ए नाइस डे।